Welcome back to the Lost Book of Herbal Remedies, where we explore both the science and natural solutions to some of the most pressing health concerns of our time. I'm Emma, and today we're diving deep into a heart health issue that affects millions of people around the world: atrial fibrillation. This isn't just another heart condition. Atrial fibrillation has reached epidemic levels with serious consequences if not properly managed.
That's right, Emma. Atrial fibrillation is now recognized as the most common type of arrhythmia worldwide. It's been linked to severe complications like stroke, heart failure, and even sudden death. And what's really alarming is the speed at which its prevalence is increasing. A recent study showed that 10.55 million adults in the U.S. are living with atrial fibrillation, a massive jump from earlier estimates of 3.3 million in 2020. That's a huge leap in just a few years, and it's bringing a lot of attention to this growing health crisis.
Yes, and what's even more concerning is that atrial fibrillation isn't just affecting the older population anymore. We're seeing more cases in younger adults, especially those with comorbidities like hypertension and diabetes. This is quite different from the traditional view of atrial fibrillation as a condition mainly affecting the elderly.
Absolutely. The demographic shift means that atrial fibrillation is hitting a broader group of people than we previously thought. It's becoming increasingly clear that hypertension, diabetes, and even lifestyle factors like stress and physical inactivity are driving the numbers up. Public health initiatives need to urgently focus on early detection and education. It's not just about managing the symptoms. It's about preventing the condition in the first place.
Exactly. The rise in atrial fibrillation cases was well documented in a study from California, which showed an increase in prevalence from 4.49% to 6.82% between 2005 and 2019. It's not just more people being diagnosed. It's also about how much earlier these diagnoses are happening, with many patients being asymptomatic until a serious event like a stroke occurs.
And that's where early screening programs could play a key role in identifying at-risk individuals. We know that early intervention can make a huge difference, yet many people aren't aware they even have atrial fibrillation until something goes wrong. As technology improves, we're seeing more tools being used to monitor heart rhythms, especially wearable devices that can track physiological signals.
Speaking of technology, a study on patients with paroxysmal atrial fibrillation recently identified common triggers, like physical exertion and psychological stress. What's fascinating is that wearable tech allowed researchers to track these triggers over time. The data showed that physical exertion was the most significant cause of atrial fibrillation episodes. This opens the door to more personalized management approaches, where doctors can tailor lifestyle changes to help reduce episodes.
That's the beauty of individualized care. Once you understand the triggers, you can create specific lifestyle modifications to reduce the frequency of atrial fibrillation episodes. It's a more proactive way of dealing with this condition, and it aligns with modern trends in patient-centered care. But of course, there's more to atrial fibrillation management than just lifestyle changes.
Definitely. The traditional pharmacological treatments for atrial fibrillation include antiarrhythmic medications that focus on controlling heart rate or rhythm, as well as anticoagulants to reduce stroke risk. Medications like beta blockers and calcium channel blockers are widely used, and newer drugs like vernaculant are showing promise by selectively targeting atrial tissue to restore normal rhythm.
And when medications aren't enough, catheter ablation comes into play. It's a procedure that's gained a lot of traction, especially for patients who don't respond well to medication. Techniques like cryoablation and radiofrequency ablation have been fine-tuned over the years, making them safer and more effective at isolating problematic electrical pathways in the heart. We're seeing more patients achieve long-term rhythm control with these interventions.
Absolutely. But as with any chronic condition, the search for better and more innovative treatments never stops. One of the most exciting areas of atrial fibrillation research is gene therapy. Advances in genetic testing are allowing doctors to identify individuals who are at risk for certain types of arrhythmias, which opens up the possibility for more targeted and personalized treatments.
We're also seeing rapid development in device technology. Leadless pacemakers and subcutaneous implantable cardioverter defibrillators, or ICDs, are transforming the landscape by offering less invasive options for arrhythmia management. Plus, AI and machine learning are now playing a huge role in analyzing large datasets to better understand atrial fibrillation patterns, helping doctors fine-tune treatments.
It's amazing how much technology is evolving in this space. But at the same time, natural remedies are gaining traction as complementary treatments for atrial fibrillation. While pharmacological treatments often focus on symptoms, many are now exploring the benefits of natural products, especially those derived from medicinal plants.
Let's talk about some of the natural compounds that have shown promise in managing cardiovascular health, including atrial fibrillation. For instance, Panax notoginseng has been used for its antiarrhythmic and antiplatelet effects. Saponins from this plant have demonstrated the ability to improve cardiac function and reduce infarct size in animal models.
And then there's Hawthorn. It's renowned for its cardiotonic effects, helping to improve cardiac output and increase coronary blood flow. Hawthorn's antioxidant properties make it an ideal candidate for reducing oxidative stress, which is a contributing factor in atrial fibrillation development.
Motherwort is another herb that's worth mentioning. It's traditionally been used for calming effects, particularly in cases of irregular heartbeat and hypertension. Reducing stress and modulating the body's stress responses are critical, especially since stress is a known trigger for atrial fibrillation episodes.
And we can't forget about magnolia bark. Its compounds may reduce anxiety and stress while also offering anti-inflammatory benefits, which could help protect cardiovascular health. All of these natural products align with an approach that focuses not just on managing symptoms, but on addressing some of the underlying triggers and risk factors of atrial fibrillation.
Exactly. And what's really appealing about these natural substances is their potential to mitigate some of the side effects associated with conventional atrial fibrillation medications. Drugs like amiodarone, for instance, can have significant side effects, including liver toxicity and thyroid dysfunction. Natural products may offer a safer profile with fewer adverse effects.
That's an important point, Alex. But as with any treatment, natural or pharmaceutical, it's essential to approach these therapies under professional guidance, especially since many of them could interact with conventional medications.
Absolutely. And while we're seeing promising results in preclinical studies, there's still a need for more rigorous clinical trials to validate the efficacy of these natural products in treating atrial fibrillation. We need to understand optimal dosing, long-term effects, and how they can be integrated into a comprehensive treatment plan.
As we continue to uncover the potential of natural products, it's clear that a personalized approach to atrial fibrillation management is essential. Every patient is different, and what works for one person may not work for another. That's why healthcare providers must consider a patient's unique genetic, environmental, and lifestyle factors when designing treatment plans.
Exactly. Personalized medicine is the future of healthcare, and atrial fibrillation management is no exception. The goal is to improve outcomes and enhance the quality of life for patients with atrial fibrillation, and that involves a holistic approach, integrating both modern medical interventions and natural remedies.
Well said, Alex. Before we wrap up, let's highlight some of the supportive measures that can complement atrial fibrillation management. Omega-3 fatty acids, for example, are known for their cardiovascular benefits, and magnesium supplementation can help maintain electrolyte balance and proper heart function.
And, of course, lifestyle modifications are crucial. A heart-healthy diet, regular exercise within individual tolerance levels, and effective stress management techniques can all make a huge difference in managing atrial fibrillation. Avoiding known triggers is another key component in reducing the frequency of episodes.
Absolutely. Whether it's through pharmacological treatments, innovative therapies, or natural products, managing atrial fibrillation requires a comprehensive, multifaceted approach. We hope this episode has provided valuable insights into how we can better tackle this hidden epidemic.
Thanks for joining us today on the Lost Book of Herbal Remedies. For more information on the natural solutions we've discussed and the latest research on atrial fibrillation, be sure to check out our full article on the Herbal Bloom website.
Stay tuned for our next episode, where we'll continue exploring the intersection of natural health and modern medicine. Take care, everyone, and remember, holistic health is about nurturing both the body and mind.
See you next time.